Hello and welcome to a special episode of SBI Life Presents Breast Cancer Awareness Special, an initiative of India Health Mission series. Now, breast cancer is the most common malignancy among women globally. From being fourth on the list of most common cancers in India during the 1990s, it has now become the first. There is an alarming rise in breast cancer cases in India among a younger audience between 25 and 50 years old. In India, the survival rate of patients with breast cancer is lower than in Western countries due to earlier age at onset, late stage of disease at presentation, delayed initiation of definitive management, and inadequate or fragmented treatment. Times Network, along with a panel of experts, today will highlight and discuss breast cancer, its impact, and effective treatment to combat this growing menace in India, all in an effort to inform, aware, and guide Indians against the threats that this serious disease poses. Allow me to introduce my experts. We have with us Ravindra Sharma. He's the Chief of Brand, Corporate Communication and CSR at SBI Life. We have Mahima Chaudhary. She's an actor, a mother, and a breast cancer survivor. And we also have with us Dr. Shishir Shetty. He's a professor and head of oncology services at CanCure Foundation and is also attached to Fortis, Reliance, and Medicover hospitals. And finally, we have Dr. Mohan Menon. He's a medical oncologist in Mumbai at Leelavati, HN Reliance Hospital, and Breach Candy Hospital. Doctors, ma'am, sir, thank you so much for being a part of this panel. Let's start off with our questioning. First question to you, Dr. Shetty. When we talk about breast cancer, what are the symptoms or what is something that women need to do to check if they have breast cancer?
Honestly speaking, there is no symptom for breast cancer. Every woman should be aware of her breast and should be aware and should examine themselves to see if they've got a breast lump. The only thing that comes up in breast cancer, which is the most important thing, is the breast lump. And if you find a lump in your breast, it does not mean that it is cancerous, but it definitely means that it needs attention and you have to see your doctor.
Okay.
That's how we start with.
Right.
So there are no symptoms, there is no pain, there is no bleeding, nothing.
So the important thing is to keep the regular self-examination, and if there is a concern, then go speak to a medical expert.
Do not delay.
Do not delay. Very important point there. We will come back to that, Dr. Shetty, in a bit. But Dr. Mohan Menon, so what is the cause for this rampant increase in the numbers, especially in the younger population of about age 25 to 50 in women? What's the cause for this?
Although we are concerned about the increase in numbers of breast cancer in the younger population, I must start by saying that the vast majority of breast cancers we have are in people over the age of 50. Now, why does this increase show up in this way? It's because of a bunch of things. One is, of course, that we are getting richer as a society. So we have adopted certain lifestyle changes that includes changes in diet and so on and so forth. It's also because there is an increase in the amount of obesity in society. And an increase in the amount of obesity, unfortunately, increases your risk for several cancers, including breast cancer. It's also probably because we are catching these cancers a little earlier because of sort of our media attention to it, as well as people knowing about these sort of things.
Okay, that's important point there. Thank you for that. Ma'am, coming to you, you are a breast cancer survivor and you've fought it like a great fighter. But the early days when you got to know about it, what were your thoughts? What were your feelings? What were you going through at that point?
It's obviously just something you don't want to hear. And you always think cancer will not happen to me. It didn't run in my family. Nobody had any kind of cancer in my family in history. And so I was taken aback because like every person, you feel it's not going to happen to me.
Yeah.
That is why we are here to talk about awareness, how you need to constantly have health checkups. Everyone thinks cancer and they're frightened, and so was I.
Yeah.
you know, because of the visuals we've been shown, whether it's in cinema, cancer hai to matlab gone.
And
But cancer patients now, as doctors will say, are living, they're getting cured.
Yes.
And when it is early stage, it's very curable. So we are here to emphasize today, how do we make it early stage, if it is?
Absolutely. And ma'am, that is the aim of this initiative also, is to educate
Yes.
women and their families as well. And yes, I will be coming to the doctors later on these points of, you know, the how dangerous is it or what can be done. But absolute your point, 100% the need of awareness and education. And Ravi, coming to you, just taking this ahead, because your thoughts on what can be done more to bring about this awareness, this education, to, you know, get rid of this fear that people have, ki it's better, don't tell me about it, I'm better off, rather than let me find it and try and cure it.
Okay, let me start with what SBI Life believes. Okay, as a brand or as an organization, we always believe that we need to have a meaningful conversation. And with this thought, the whole initiative of, you know, Thanks a Dot started, where we wanted to create a meaningful conversation in the society and talk to them that how they can actually come over the whole thought process, fear, the way you want to put it across, of cancer. Today in the society, there is a conversation happening around cancer, and people, with respect to breast cancer, people are aware about it, but is it good enough? My opinion is that yes, there is a lot of scope to improve.
Right.
You know, the intention is to take this conversation into the living room rather than being in a closed door conversation. Today in the society, people are hesitant, you know, to bring it even in front of their loved ones. That something like this is happening to me. So how can we break it? The whole idea is that, and if as a society or as a responsible corporate, you know, can I do these things? You know, that's where we are trying to be a part of it. And if other corporates can also become a part of it, it will help. So one of the intention or the program of Thanks a Dot is to reach out to multiple corporates and actually, you know, educate the women employees there about breast cancer and how they can come over the whole fear of breast cancer.
Absolutely, because the easier it is made, the better the adoption always is. Ma'am, coming back to you, from your experience, your thoughts on the importance of the family's role, the family's support. How was it for you, and what's like your learning from that that you would like to share with us?
Yeah, you can't do this alone. And the support that you get from the family and the friends, they called up friends who had gone through this treatment and who were living, mothers of friends who said, Beta mujhe 30 years back I had this, and look at me, I'm doing fine. That gives you confidence. And of course the doctors, because they tell you that since it is you know, an early detection, today cancer treatment is not what it used to be. It is far better, and universally it is quite the same. It's whatever treatment you will get in America, you will probably get the same treatment here, or it will be better here because you will get the support of your family and friends. Earlier we had to fly to countries, and now the treatment is good enough here. But the only difference between the West and India is the treatment is the same, but there the number of people who survive breast cancer is 98% because they detect it early. Here it is far less because we detect it late, and that's why this campaign.
On that note, it's time for a very short break here on SBI Life Presents Breast Cancer Awareness Special, an initiative under India Health Mission series. Don't go anywhere, we'll be right back. Welcome back to SBI Live presents Breast Cancer Awareness Special, an initiative under India Health Mission series to highlight and discuss on breast cancer, its impact and the need for creating awareness towards this growing menace in India. Dr. Shetty, the survival rate, ma'am saying that, early detection is a big differentiator. I want your thoughts on that as well.
To add to what she said, patients do not need sympathy. People who are going through cancer treatment do not need sympathy, they need empathy, they need support. They don't need wrong advices.
Yeah.
They need correct advices, not internet-based advices, because that can deroute everything.
Absolutely.
One, if we want more cure rates, if we want more people to survive, we need to catch this cancer very early. Of course, not undermining the role of preventive oncology, where we talk about lifestyle changes.
Yes, yes.
Which sometimes people put it as a back burner.
Dr. Menon, getting you in also on this, just if you could share your thoughts, your experience that you've had with patients as to this importance of this self-examination, of early detection, your thoughts.
So, breast self-examination, I think, is something that probably every woman who is who has the possibility to get it done on a regular basis should do. Probably once a month would be a good time. Do it at a time when you're post your periods, that means about a week after your periods, and do it regularly. And there was a system when I was a fellow at Roswell Park called Buddy Check. And here what happens is two people, that is you and another friend, or you and your sister or someone, you remind each other on a particular day to do the breast self-examination. That way, if you forget, your relative or friend tells you to do it, and if your friends forget, you will remind them. So that might be a simple way to do it. When you follow this on a regular basis, you will be quite aware of the changes that occur.
Right. So, Dr. Shetty, I'll just come to you before I move back this side. There would be women who would be going for these yearly checkups. So they're like, what's the need of a self-examination? Why do I need to do it monthly? What's your take on that?
So the most important thing that we see here is that a woman would know her breast the best. When we focus on self-breast examination, we are talking about feeling the change which only the individual can have.
Yeah.
Because that change month on month would be detected by self.
Right.
Because these are subtle changes. If you do something every day, you will not detect it. Because you have to do it. That is why this interval, do it a monthly one. Because in that 1 month, that change would be detected. And this is where we are focusing. We are not talking that you want to detect a 4 centimeter lump. We are not talking that 2 centimeter lump is easily palpable. We are talking about that subtle small change in your breast, which a woman, if she is doing her self-breast examination, she is in the best position to examine.
Wow, that's really important. Thank you for that. Ravi, I want to come to you now. Thanks a Dot is a multi-year campaign of SBI Life. Can you tell us a little bit more about what you're currently doing under that campaign?
As rightly said by you, that it is a multi-year campaign. Let me start with the background. Okay, obviously we all are aware, the numbers are increasing. So the thought was that how can we, give back to the society, and then what can we do? Okay, was the thought process. During this whole journey, we came across, Braille, the blind people. Okay,
The language.
okay, so if they are able to read, okay, with just my tiny alphabets with their finger, the tactile touch.
Yeah.
And the bottle is quite like that.
Right.
These
Absolutely.
are real lumps, different sizes of the lumps, and this is the.
So so we created these lumps which are of real cancer. And the idea was to activate the tactile.
Right.
Okay, and which will help the women to identify the change, as Dr. Shishir and Menon were talking about. If they do the monthly checkup,
Right.
what is the change they are looking for? Okay, and that is where it helps. Now the question was, why a hot water bottle? Again, the study clearly told that almost 85 to 90% of the women, during their period, use hot water bottles, to, relieve themselves or ease themselves from the pain or whatever they are going through at that time.
Right.
Okay, so that's where we said this is the best thing. And this bottle is not only used in a certain kind of society, it is used across society. And as a brand or an organization, it is not that we're going to stop it now. Every year we try to make it a notch higher and increase the decibel around the whole conversation. So that's the thought process.
Ma'am, like Ravi was saying, you're associated with this campaign. What were your thoughts? And when you said that, yes, I want to bring, help spread the awareness for this important campaign.
SBI Life has been doing this self-awareness for women. Like they said, they wanted to do something for women. And this just topic is so personal to me because of what I've gone through. And I feel it is extremely important to create that awareness, and through, like he said, through schools, to educate children earlier so that you are aware of your health. You take initiative, especially women need to take that initiative to look after their health, and health checkups is part of that. And I think all organizations, your organizations, communities, all of these people should help people become aware and spread awareness and go and do tests and be the more we are vocal about it. Like I had other people before me share stories, whether it was in India or abroad. I have read them. That created awareness in me. Whether you have cancer or don't have cancer is not really that much in your control. So talk about it, have the conversations.
And because, ma'am, there was a time in this country where, conversations around periods were a taboo, and you couldn't say that word.
And sanitary napkins were wrapped in
that black
newspapers.
black plastic bag and all of that. But now it's become a living room conversation.
Yes.
So, and I'm sure, with this initiative, thanks a lot, and that's our aim also here, to make this an everyday living room conversation so that nobody has to hide and talk in hushed tones about it. Dr. Shetty, before the shoot we were discussing, and I want your view from the behavioral aspect of women, because a woman might even detect the lump in self-examination, but she might just say कि मुझे दूसरों को, मेरे घर वालों को तकलीफ नहीं देनी. I don't want to disturb my family. It'll go. Forget about it. देखेंगे. Your thoughts on that?
The problem with women in our country, unfortunately, is in spite of being, they don't realize how important they are, being the center of the family. There is a denial.
Yeah.
There is ignorance. And third thing is, everybody comes first but me. So they have all the other work. Their husband has got work, the kids have got work, but their breast lump will say, we'll do it after some time. That delay which occurs is something which is killing our country, killing our women's. Denial, ignorance and delay.
Wow.
This is something which is crazy, and if at all we have to do something, we have to address these three important things. And I think by spreading awareness, SBI Life, Mahima here, media,
absolutely,
we can just treat and help you to do this, but that's where we are talking about saving countless lives.
That's so beautifully put, because denial, ignorance, delay is DID, but they're actually not doing it.
Yes.
So instead, do it and let it be a did, that I did do the self-examination.
Yeah, that's
and very well put. Ravi, in life we can't predict a lot.
Yes.
One of them is about health, but in this health space, there generally people don't realize the importance of private stakeholders like yourself, and also the importance of insurance. What's your message? How do you think that life insurance plays a key role in someone's journey?
We need to understand that when something like cancer, unfortunately, if hits, as the panelist was talking about, it doesn't involve only the person who is detected with cancer. It involves the whole family.
Yes.
So we always try to put across, there are two types of drainage which happens. Okay, one is the emotional drain because of this in the family. And as Dr. Shetty mentioned very nicely, that they don't require sympathy, they require empathy. Okay, and it is the patient and the family all together. Okay, so that's the first drain. Second is the financial drain in the family. Okay, before the cancer, the family is saving money, doing things for certain dreams and goal.
Yes.
Now, if something like this comes and hits the family, it is impacting the whole family, what they have their goals and aspirations. Now that is where insurance comes and plays a role. We were just before the shoot talking कि मरने के बाद पैसा मिलेगा तो क्या फायदा? So the answer is very simple. Health insurance, the name health, clearly tells you that it is for your health. Life insurance is also the same way. It is not about death. It is about the people who are living behind you once you are gone.
And they are the people that make your life.
Yes. And that's why it is called life insurance. Ki if I am there or not there, okay, there are certain life who depend on me.
100%.
Okay. This life insurance will take care of them.
On that note, thank you so much, Ravi. Thank you, ma'am. Thank you, Dr. Shetty. And thank you, Dr. Menon. While these conversations are important, what is more important is for more people to associate themselves to drive awareness. I'd like to thank our panelists once again to bring their insights to this table. Thank you so much for watching.